All right, greetings and welcome back to the For Health Scholars channel. If this is your first time tuning in, welcome, welcome, welcome. My name is Dr. Orobosa, and on this channel, I show current and aspiring healthcare management, administration, and public health professionals how to one, quickly and successfully earn their degrees, and two, how to start, build, and enjoy profitable careers within the business side of the healthcare industry. Now, today is a Q&A session. It is the first Q&A session that we have here on the For Health Scholars channel, but I know over the last couple of months since I launched the For Health Scholars platform, I've been getting a series of questions that people want some in-depth responses for. I mean, I love the questions, absolutely. And so tonight, it is a start to what could potentially be something that we continuously do here at the For Health Scholars community, but we're going to focus on answering Q&A sessions, focus on answering questions about the healthcare administration, management, and public health space, and just questions that you may have in general about the field of healthcare. Now, I am very much live, and so if this is your first time tuning in, you can drop your questions in the live chat replay. I know this is my first time streaming live on LinkedIn, but I think if you drop your questions in the comment section, I could pull it up here on the screen and of course give you an answer. So I see somebody has joined. Let me show that. Hi, hello, Fee. Welcome, welcome, welcome. Thank you for joining me tonight. If you have a question, just drop it in the chat box and I'll be more than happy to respond. All right, so without further ado, let's jump into the session. So I'm going to start off with the first question I received. And so the first question is, are there any one-year healthcare administration doctoral programs? And honestly, I don't think so. I have to be honest. A doctoral program is not something that you can complete with I would say it with great speed or urgency. It takes at least three. I've seen people complete their program in like 5 years, but the doctoral journey, it can be quite long. And so if you get a professional doctorate, those programs are shorter than a research doctorate, which is a PhD, but it does take you some time. So don't expect to like start, it's not like a master's program or undergraduate program. You have to make sure that you are dedicating at least 5 years to the industry. If you do it faster, kudos to you. But I know the first 2 years of many doctoral programs, you are going through didactic courses, so courses that are preparing you for the writing stages of your dissertation. And then after the writing stage of preparing that preparation, then you go into writing your dissertation. And through writing your dissertation, you go through a series of committee reviews. So you have to keep that in mind. It is not a linear process that you see under the undergraduate or even at the master's level. The doctoral program is a different ball game in general, and you really have to work through your writing to get approved through different committees. Some universities may require you to take an exam before you can even transition into the dissertation phase. So you have to keep that in mind. But absolutely, I would encourage people to get your doctorate, especially in the field of healthcare administration. The field, I will say the healthcare administration field is new. However, I will say that it is becoming more popular. And so many people are getting their degrees in healthcare administration or management or even public health. And now they're like, okay, how do I advance myself as a professional in this space? And of course, how do you do that from the formal education route? Then getting your master's and even doctoral program are options out there. So I see a few people are here. Let's see, we have hiking, healing, and inspiration. Hi, thank you for joining me live. Okay, I have another question from Ade, but I'm going to answer your question in just a second, Ade, but thank you for joining. So I hope that answers the question about doctoral programs, particularly in the space of healthcare administration. No, I don't know of any one-year programs. It is not a process that you can complete with speed. However, you can get it done, I think, within 4 to 5 years at minimum. I've seen people do 10 years in getting their doctoral program, but like I said, it really varies on the university, how well you have passed all of your didactic courses and met the criteria to become a doctoral candidate. So being a doctoral student and being a doctoral candidate are two different things, okay? And in order to get your candidacy, you have to pass all your courses. If you have to take an exam, then doing the exam, and then now you get into the writing phase, which makes you a doctoral candidate. But to become a doctor, your school has to confer that. So I see Kenya is on. Welcome, Kenya. Thank you for joining. I see Brianna as well. Brianna, thank you for joining. Kudos to you. If you're just tuning in, welcome. We're having a Q&A session all about the field of health administration. If you have a question, you can drop them in the comment box and I'll pull it up here. But thank you to all of you who are joining. All right, so the next question I have is, should I get a PhD in healthcare administration or a DHA? And if you watch my video on what it takes to become a doctor of health administration, I really tell you that I can't answer that for you. Like, that requires you to do some research. It requires you to sit down and conduct some type of an assessment on where you see yourself being. Now, a professional doctorate and a research doctorate, like a PhD, are different in their own right. Of course, both, once you complete either program, you do become a doctor. However, the track to becoming a doctor as a PhD is a little different than a professional doctorate. I have a professional doctorate, so I did a Doctor of Health Administration program. It took me 5 years to complete the program. We both, in a PhD and a DHA, you do write a dissertation. You do conduct research. So both degrees require you to conduct research. Both degrees are, I would say, how can I say that? They're extensive in their own right. So a PhD is not better than a professional doctorate and vice versa. It's just depending on your personal goals and what you're going to do with the doctorate degree once you've obtained it. So if you want to, and let me be honest here, go into academia, you want to teach at the university level, then a PhD degree may be more advantageous to you. However, as if you have a professional doctorate, you still can work in academia. However, but most people who acquire a professional doctorate, they go back into the field. So they want to lead healthcare systems. So I can't answer this for you. However, I will tell you, do your research, sit down and really look at the goals that you have and what you're wanting to do once you've gotten the doctorate degree, and that will determine which doctoral path you should take. All right, so I'm going to pull up the question from Ade, and it says, on the field of work, what is the difference between healthcare administration and health services administration, and how do we handle the gap? All right, so Ade, this is a loaded question. From the top of my mind, healthcare administration and health services administration are similar. However, depending on the university you go to or the organization that you work in, they may title it differently, but health services administration, you are managing the services of healthcare. The same thing with healthcare administration, you are managing the business side and operational side of the healthcare system. I did do a video that talked about the differences between a healthcare management and a healthcare administration career path. And I stated in that video that healthcare administration is the general field, and the management aspect is like a subfield or subcomponent in the healthcare administration space. But you'll find that many universities, you will find that many organizations, they use the names interchangeably. So are there any like ginormous differences between the two? No, it's just titling there. How do we handle the gaps? That is very loaded, and it depends on what type of gap you're trying to address. Now, we do know that the healthcare industry, it is multifaceted, it is highly complex, it is highly dynamic, and depending on your background and where you intend to use your skill sets on the business side of healthcare really allows you to determine how you're going to handle gaps. We know there are community gaps, we know there are administration gaps, we know there are finance gaps. I mean, the gaps in healthcare vary, but you would have to give me a little more information on exactly how you or what gaps you're talking about, and then I can give you the best answer to handle that. But thank you for the question. All right, I have another question here from Kenya. She says, what can I do with a bachelor's in healthcare management? You can do a lot. Under the business side of healthcare administration, I know for many individuals who are in this space or have a degree with a bachelor's of healthcare administration or management, you're like, okay, what should I do? And you should really be focusing on the developing experience. So if you want to be, because healthcare management is managerial focus, although you can work in other roles, but you want to start getting some experience under your belt. You can apply for some entry level managerial positions. You can even work in other type of sectors under the business side of healthcare. So do know, healthcare administration is a business component of healthcare. And so as healthcare administrators, you are responsible of handling the operational side, the financial side, depending on what department you're going in. You can do quality, you can do risk management, you can do tech in healthcare. So you have so many different opportunities. But once again, it goes back to your interest. What area are you interested in working in healthcare? And then from there, learning the requirement. But at the entry level, at the bachelor's level, you can work in practice management, you can work in performance management, risk management, you can work in insurance and managed care, you can work at the nursing home. So when I had my bachelor's degree in healthcare administration with a specialization in healthcare operations and management. So it's just like a titling thing with many universities. I graduated with my bachelor's and I was a practice manager. And at that point, I was managing 2 clinics. But not everybody is interested in working in direct patient care or direct patient care management. You can even do patient services, Kenya. So the type of jobs you can work with a bachelor's degree vary. It's just, once again, going back to your interests. All right. I hope that answers your question. Okay, I'm going to move on to Brianna. I see Hector has joined. Hector, welcome. I'm going to answer your question in just a second. Okay, Brianna says, would you recommend putting relevant coursework on a resume for someone who doesn't have experience in healthcare administration, but is interested in a job in the field? And so, yes, absolutely. But do note there are different types of resumes. So you have chronological resumes, functional resumes, and your functional resume focuses on your experience, right? And so for many of you who may not have an experience, and when you say you do not have experience, first, make sure count your internship, or if you did an externship or you volunteered somewhere, that is experience. But in your case, if you know how to package what you've done in your coursework on something like a functional resume, it will definitely be helpful to you. And as you're trying to acquire a job, I would even look for transferable skills. If you don't have any experience in the healthcare space, but you've worked in other organizations, in other industries, look for some transferable skills there. So communications is a big transferable skill. Like being able to communicate with consumers is no different than being able to communicate with patients. It's just a titling thing. But look for some entry level positions if you don't have any experience. Also, reference back to your internships, externships, or even volunteer experience. I know for many universities, in order to acquire your degree in the healthcare administration management space, you have to do some type of field work, and that field work can be internship, it can be a couple of hours at a facility. So leverage those experiences, leverage the things that you have done, and if you worked in other industries, that can be helpful to you. All right, Brianna. But absolutely, if you know, it's just about verbally articulating what you did in those courseworks and how those courses and how that would help an organization that you're applying for. All right. So I have a next question from Hector. Hi, Hector. Welcome. Okay. He says, I was thinking about a doctor of health science. What are your thoughts on this degree for someone who has ambitions to teach at a higher ed level and potentially working in leadership roles in healthcare administration? Please go into details related to pay to the best of your ability, career outlook, mobility, and versatility to move or transition to other fields and areas. So a health science degree It is slightly different than a health administration degree. You can get a doctorate in health science, but that is more of a professional doctorate. So if you want to work in academia, I would tell you look more into the PhD, just because many universities, it just makes you more versatile. If that's your end goal, if your end goal is I want to work in academia, you don't want to work in the field or your industry, then a PhD may be better, because many universities want you to have a PhD. Although if you have a professional doctorate, they're now opening up to this idea. What are your thoughts on a degree where someone has ambitions to teach in higher ed? Okay, I addressed that. Potentially working in leadership. So leadership, yes. So it just depends on how well you can sell your skills and what opportunities you come across. So health science, I don't know extensively about that degree, but from the little bit of courses that I taught, that from the university that I worked in, they are some business side. So if you had some business courses in the health science program, that may be right for you. But I know individuals who go into health science or have a health science degree, they're more in public health, they're more in public health is more of the advantageous field than versus administration. But if you can show that you have business administration knowledge or a managerial knowledge in the field of healthcare, that can help you as well. Pay, I'm not sure what the pay is for a person who has a doctor of health science. Then explore that. But I will tell you to go to places like salary.com, payscale.com, ask people who are in the field. You can go on LinkedIn, and in the criteria box of LinkedIn, you just put health sciences. Usually people have their degree in there, and you can converse with them and they can tell you what they pay. But I don't know what a health science professional gets paid. Career outlook, it can be promising. One of the things I do know is that the healthcare industry is in demand. And because it's in demand, there is a need for human capital, aka us, professionals who study the field of healthcare, whether it's through health sciences, administration, or even in your clinical degrees. So you have to find the area that is most advantageous. It's not a like a specialty of mine for health sciences. I did teach a few health sciences courses, but that was for students who were in a health administration program, but also was doing some type of clinical work as well. And they wanted to do, I mean, not health administration, public health. So I hope that it answers your question. Mobility and versatility, you can be versatile just on how well you can sell yourself. And that's just something I really want to stress for those of you who are tuning in. It is how well you can sell your expertise when it comes to getting a job. How well can you articulate? You can have two people, person A and person B, have both similar experiences, have similar education, but one person is going to get the job. And the person who gets the job is the person who has been able to market in a technical sense their skill sets and show proof that they will be the best candidate for the job. So versatility in the healthcare space is definitely there. From the health sciences background, I am not 100% well versed. I'm not going to sugarcoat it for you, but I do know about the healthcare industry from a business side component. There's definitely versatility there. Okay, I have another question from Kenya. She says, I have an LPN for 27 years and I'll have my degree in April. I want to get off the floor and get behind the scenes. I only have floor nursing experience. Well, Kenya, if you're already working in a healthcare institution, you already have an added advantage because you're in the environment. The next thing that you need to do is find areas where you can lend your expertise, or even if you're looking for a job opportunity in the administration space, leveraging the opportunities within your organization. A lot of my experience came from I was hired in one role. And after I showed my credibility, after I've shown that I'm really skilled at transforming different things and working on different committees, that allowed me promotion in many different other areas of healthcare. And so, Kenya, I would say if you're working in a healthcare organization, leverage that, serve on some committees, lend your expertise that way, speak to a few hiring managers, see if there's a position open, you have an added advantage. If you are an internal candidate, they usually give those opportunities to you first before an external candidate. But to get that experience, try to serve on a few committees, try to volunteer. If your degree program requires you to get an internship or externship, leverage that as well. And all of that can help you transition into more of the administration side of the healthcare space. Okay, I have another question. Actor says, also love your videos and I think you're very articulate. I appreciate your efforts in educating upcoming leaders like myself. Thank you for your hard work, Dr. O. Well, thank you, Hector, for your kind words. I used to be many of the people who are joining the community. I used to be a student. I used to be a professional working in the healthcare space. I used to be the individual who was looking for opportunities. And I find that the path in healthcare administration is not well documented for many people, or even in management and public health. And I just wanted to create a platform where you can learn from me and my experiences, and then also bring other experts in the field who can also share their experiences, because I don't know it all. But Hector, I appreciate your kind words, and continue to be a part of the community. Okay, Kenya says, that helps a lot. Thank you. Okay. Okay, I've got a couple of questions in the queue. Okay, Hector says, I would be so blessed to connect with you offline for guidance and tools that you can offer me, please, and thank you. Okay, Hector, you can send me an email at hello@forhealthscholars.com. All right, and then we can connect there. So it's hello@forhealthscholars.com. Brianna says, thank you. Okay, here's another question. I'm graduating with the MHA next month. I'm having trouble and challenges to find work as they require and prefer those with more experience. I'm already an early careerist, so any tips you can offer would be great. Yeah, Hector, and I think for a few people have asked me this question who are just starting out. So post-pandemic, the healthcare landscape has completely changed, but it's changed in a good way. So there are demand for healthcare professionals to work in, but how you used to acquire jobs in the healthcare space, we can't use those strategies. You have to use I would say post-pandemic strategies to acquire healthcare jobs today. And that includes doing untraditional methods of just applying into the job. You're going to have to network. You're going to have to put yourself out there. Recruiters are a big one, and a recruiter. And I'm telling you about recruiters because 5 years ago, when I relocated from New York, I relocated to Texas, didn't know anything about the Texas healthcare network, didn't have any contacts, didn't have anything that would allow me to get into the space of healthcare. I did not come down to Texas with the intentions to go back into the field because I was already working in academia full time, but my contract changed in academia, and so I needed to find work. And the two things that I did: first thing is I was looking for healthcare hiring events in my area. And the second thing that I did was work with a recruiter. And a recruiter served as that liaison person for me because they have a contact with the direct organizations that they are hiring for, as well as that they had effectively screened my skills. And they helped me so much because they gave me the opportunity to network and really provided a few jobs for me. I did not get a job. I did not take the job, rather that a recruiter offered me, because I was also in my end doing my own form of networking. And the job that I acquired, which was to be a health educator within the hospital, I obtained that first, and it was more of what I wanted to do. But the recruiters, they were moving pretty fast with me. They were like, okay, give me your resume, give me your cover letter. Do you have any skills? And they were moving to try to place me in opportunities that they have available. So you're going to have to do untraditional methods to get hired these days, but it's definitely possible. I saw and I've read reports from the Bureau of Labor Statistics and other just healthcare outlets that are saying that the demand of healthcare is high, because as much as you are coming into the field, many people are leaving. Many people are transitioning to other career paths, and they're leaving the healthcare industry behind. So you just have to find and continuously be consistent and just going after opportunities. And so I encourage you, Hector, to look at my video from a series that I did called Career Miss. And that first video was a strategy on how to get a healthcare administration job quickly. And it takes a little work. All right. So you're going to be applying to jobs every day. But think about the law of large numbers, where they tell you that the more you do something, the higher possibility that it will happen for you. So set a goal for yourself, Hector. 5 to 7 jobs per day. That's what you're looking for. That's what you're getting applying to. And of course, do some networking. Use LinkedIn, use staffing agencies is another good one. Ask people around. Sometimes you can even volunteer at hospitals. Look into teaching hospitals. They're always looking for healthcare professionals. And I'm going to talk about that in a little bit in our session for today. But you're going to have to think outside of the box, Hector, to get a job in healthcare today. Okay. All right. So I have a couple of questions. I'm going to get to everyone's questions in the queue. Okay. I just finished my master. Addie says, I've just finished my master's program in health services administration with no experience in health administrations. Most jobs offer an entry level where we're receiving incoming calls and patient associate. So I think, Addie, I seen a comment from you on YouTube earlier. I think you put a comment under one of the videos. I think you're a financial person. And I even think in that comment, I asked if you could just give me a little more about the type of jobs you've been applying for, because healthcare finance is another in-demand department. So looking at the entry-level jobs, asking around, like using LinkedIn to leverage and establish connections. Fellowships is another good opportunity. I'm going to talk about fellowships because I have a fellowship directory available for you all to sign up for. So I will tell you, you have to leverage your university. I don't know if you got your master's degree here in the US, but most universities here in the US have a career services department. You can network with them. And I think you said yes. Okay, that was you. All right. So networking with your career services department, looking for jobs. Now, do note, and this is something for everyone, 80% of the jobs that are available are not on the traditional job boards like Indeed.com or what is the other one? Monster.com. They're not there. They're actually on what we call a professional association. So I don't know what the professional association is for finance. I think it's the Health Financial Management. Yeah, there it is. The Health Financial Management Association. They too have a job board. And if you become a member of these associations, you get access to direct hiring managers that way. Sign up for their mailing list. It goes down in the email. Okay. And I know for many people, like, I don't want people sending me emails all day. That is your preference. But if you sign up to these associations, you become a member. I'm a part of a listserv that is for professionals who want to get jobs abroad, and they send jobs every day in the email. And that they don't have a traditional website for that. So you're going to have to kind of tap in and explore those routes. So let me restate them. Explore a staffing and recruiter route, explore your university's career center, also join your professional association. Healthcare administration has their professional association. So you have the American College for Healthcare Executives that are out there. You have the Healthcare Administration Association. So there are so many different associations. Just type it in Google. What is the Professional Association for Healthcare Administration, Management, Public Health? They'll come up. Sign up for their listservs. If the membership fee is affordable, become a member, right? And I know for many people, like, I don't have money, or, but sometimes you have to spend a little to get what you need. So association fees, if you're a student, they do give discounts for the most part to students. So you're going to have to tap into those avenues to get hired. You don't have to work in incoming calls or customer service or in the call center. That's not the only entry level jobs. So you just have to kind of think outside of the box a little bit. What are some traditional roles you see in finance? And then now explore those roles and see if they're available in healthcare. So I hope that answers your point, Ade. Okay. Maria says, Marie, sorry. Hi, Marie. Welcome. She says, thinking about changing career, what would be your recommendation in tailoring your resume to meet the job duties for the new position if you don't have those skills? Looking for transferable skills. That's the recommendation I have for you. Transferable skills. In all industries, there are some skills that are basic. Writing well, Customer service is another one. And Marie, if you don't mind dropping in where particularly you're trying to change your career to in healthcare, um, I can tell you, I my last job before I was in academia, I was a healthcare educator. I have never worked traditionally as a healthcare educator according to the job description. But what I did was I leveraged my skills from academia because that's education, that's instilling knowledge in people, and I curated a resume that would allow me to be qualified for that health education position. So the key thing of it is finding your transferable skills and then using those transferable skills, selling it up. Also looking at the job description. All right. And look at the job descriptions of the jobs that you want to apply for and what they're telling you that you're looking for. Also, look to see if you have that experience. And I do have a course that is called From Healthcare Graduate to Hired, where I'm going to do it starting January 7th. And in that course, really go deeper in helping you go from just being a healthcare graduate to job seeker to hired. So that's another option for you, Marie. But I would tell you for 100% that you look for the transferable skills. Okay, from social work to health systems specialist. Okay, so social workers are used in healthcare and in health systems specialists. So it's about managing a system or operating in a system. Now, what you've done in social work, you've done from my experience of working with social workers. So case management, you probably have organizing case plans, patient plans. You have probably done some outreach and marketing and being a liaison and a representative from the organization where your social worker at between the patient as well. So you can tap into those skills as well and now leverage those skills that you see in the job description. So having your customizable resumes available and look at a job description. And let me see if I can do that. I'm gonna pull up a job while keep dropping your questions in the comments box. And I just want to give you a live demonstration of how you can actually look at a job description and tailor your resume to that using keywords. I'm gonna try to find a job really quickly. I wasn't planning for this, but okay, healthcare jobs. Okay, health. I'm gonna just put that health systems. All right, I'm just looking for the. Okay, so I seen a job here. I can share my screen. Let me see if I can share my screen. All right, so I put health system specialist in. 104 jobs came up. Let's just look at medical services. So just to show you how just a title can mean so much in different or it means something differently for different organizations. All right. Qualifications. Okay, this is a military thing, but I'm trying to look for the description. All right. Okay. Requirements, duties. All right. This is not a good one. All right. I'm gonna try to find something, a job description. Let me see if I could go to Indeed.com. Okay, health systems specialist. Okay. All right, bear with me. If you're just tuning in, welcome. We're having a Q&A session on health administration, and I'm just trying to show you how to find some transferable skills that comes up. All right. So here, even when I put health system specialist, oh, it gives me a multiple of different job roles here. I'm trying to find one that is closely in alignment to what you want. But just looking at the job description, just for the essence of time, and finding skills that they're asking for there and see if you have those skills. And then you add those skills on your resume by showing them as achievement. So just don't say you've answered telephones. Talk about the volume, add numerical numbers to that. That helps sell your resume and hopes to get the attention of a hiring manager. But most of the time, you're going through an applicant tracking system. So you have to keep that in mind. As that job description comes up, I'll try to pull it up on the screen again. All right. I'm interested in a career change as well. Not sure what specific job I'm interested in, and just something in healthcare administration. I've been in childcare field for over 6 years. So, Brianna, I will tell you, you have to have a little more clarity on exactly where you want to go, because that will help you go after the job that you think you want to work in. So health administration is a very broad industry. There's so many different sub departments and jobs under health administration. So you have to specifically do some assessment and see, okay, what part of the health administration side do you want to work under? And then now tailor your career change towards that. Do you want to be in communications? Do you want to be? I took a marketing class in my healthcare administration undergraduate class. So marketing and communications falls under that umbrella. There's so many different roles. So you can't just say that you want to help. I mean, you can, but just say you want a something in healthcare administration. That's very broad. Let's get a little more specific, and that will be helpful in kind of giving you some guidance on what's next and what type of jobs you can apply for, and leveraging your transferable skills. All right, I see that's the questions that I have in the queue. So I'm going to go to the questions that I also was asked that I put on my screen as well from the comments that I've pulled. So let's see. Okay. Dr. Orobosa, how did you start your healthcare administration career? I thought this was a good question to ask. So I started my healthcare administration career not with the intentions of going in healthcare administration. I started the healthcare administration career as an outlet from not doing nursing. So, excuse me, my dad wanted me to do nursing. I wasn't interested. I did 2 years of the nursing degrees as an undergraduate. And then I felt like it wasn't for me. And that's how I got into administration. Oh, excuse me. How do I acquire healthcare management and administration internship? So leverage your university as well. If you're getting this from a university, if it's a requirement, your university does have contacts and partners. Okay. If you're at the master's level, you do have a thesis supervisor. Your thesis supervisor can guide you there. Also, your university, sorry, I'm choked up a little bit. Your university as well can help you get an administration. But then if you are trying to get an internship on your own, most of the time, organization wants you to be affiliated with a credible entity. So if you are a student needing an internship to get your requirement or meet your degree requirements, start with the university. Also, teaching hospitals are a good one. They have so many different programs, and teaching hospitals are receptive to learners because they're a teaching hospital. And so teaching hospitals don't only just deal with clinical professionals. As administration professionals, you can see and explore teaching hospitals. If you're in the New York area, I know Presbyterian is a teaching hospital. Columbia is a teaching hospital, hence Columbia University. So that can be a route for you as well. Internships, you may even need to just do some outreach on your own, like just Googling hospitals, Googling hiring managers if you can, and calling and inquiring. 9 out of 10 times, they will direct you on what way you should go. I used to work for a hospital, and it was a teaching hospital in Houston. And we used to do affiliate contracts all the time, partnering with universities, taking their students so they can do internships. So the first place you should start for an internship is your university. They usually have some type of directory, a partner healthcare entities that you can do your internship, and that can give you a starting point. Look at teaching hospitals. Also, somebody asked me, is there a staffing agency for internships? I don't know of that, because internships they are not paid. All right. And the staffing agency, their core focus is to place candidates in exchange for revenue. So most of 9 out of 10 times, the staffing agency is not finding an internship. But just look at organizations, connect with people on LinkedIn. If you see a hiring manager, look at their title, if they're in their background, if they're a director, inquire with them. But first, start with your universities. All right, I currently have a health sciences major. Should I switch to majors in order to obtain a healthcare administration job? You don't necessarily have to switch majors, especially depending on where you are in your degree program. You've spent all that money and you've taken a lot of the coursework. And so once again, if healthcare administration is for you and you're not wanting to switch majors, you just find skills that you can use in the healthcare space. Also take courses in business administration. So you're in health sciences, but if they have electives that are in like performance improvement, that's always some type of elective. Organizational development, organizational management, take electives that can help you also gain the formalized education that's required in a healthcare administration type of job. Okay. How do I find a healthcare administration and management job? So this is very loaded. There's so many different avenues. If I was to start to look for a healthcare administration job, of course, I will Google depending on if I want to go in the hospital, do I want to work outpatient side? Do I want to work behind the scenes? Do I want to do billing? Do I want to do coding? I have to start there and say, okay, what do I want to do? If I want to work in operations and I want to work in operations in the hospital, I will go to the hospitals of my interest websites and see what type of jobs that they have there. Is there any contact information there? 9 out of 10 times these days, many of the talent and acquisition process is being managed by an applicant tracking system and technology. But I would apply there. I would go on places like LinkedIn and see if I can find a hiring manager or somebody who works in the university who can lead me into learning more about the organization, having traditional conversations. I would tap into recruiters. There's so many different ways you can find a healthcare administration and management job. The first two things that you need to have, though, is your document. So your resume, make sure that it's tailored to the job description that you're applying for, and then put your faith into this. Like I know that many of us may not follow the same faith, but I put it in the hands of God. What's for me will be for me with application. So the application part of it is that you are looking for the jobs, you're applying for the jobs. Do know rejection is a part of that process, but there's no one specific avenue or place to find healthcare administration jobs. You just have to really exhaust all options. If I was to answer that question, can a healthcare management degree obtain a performance improvement specialist job or just healthcare administration? Absolutely. Performance improvement is all about helping healthcare organizations improve in their operations. So operations is a part of administration and management side. So absolutely, if you're a healthcare management professional, have a healthcare management degree, you can work in a performance improvement specialist job. If you really want to make performance improvement your career path, then definitely take courses if you're currently enrolled into school that focuses on performance improvement. Also, certifications are a great avenue if you are pivoting into this industry or you don't have the experience. You can also get certifications. There are some certifications that are free and low cost. So like platforms like Coursera, that's a good one because that platform, they're using university professors to teach these courses. And I think some degrees, if you want the certification, the actual certificate, you could pay a certain price, I think like $45, depending on the type of course. They'll give you a certificate that comes from the university. So that could be another option. There are certs can be expensive as well. It can feel like a cert is a whole degree program. So just exhaust all platforms, but absolutely, to answer this question, you can work in performance improvement as a healthcare management degree holder. Can I include my volunteer experience on my resume, although I didn't get paid? Absolutely. Experience is experience, regardless if it was paid or not. Experience is experience. And once again, it's just on how well you articulate your skills. And this is where word choice comes to play. All right. And just not just saying that you did the thing, but how did you transform the job and where you worked, or the experience that you acquired through this internship or volunteer? How did it transform or create some type of success metric in that organization when you were in that position, whether you were volunteering or interning? That's what I would tell you, but absolutely include it on your resume. I graduated. Here's another question I got. I graduated with a health administration degree many years ago. I'm trying to restart my healthcare administration career. What I need to acquire any certifications to help my career restart? So the answer is you don't have to require certifications, but if you have the ability to acquire certifications, then absolutely, because we know that the healthcare industry is always changing. And what we used to do 3 years ago is not even what we do now in many areas of healthcare, especially on the operational side. Post pandemic, it may look completely different, or whatever area under the healthcare administration umbrella, you can get a certification and learn new skills. I don't know how long ago you got your health administration degree, but if you have the ability, the time, and the money to take a certification, it doesn't hurt. Is it needed to restart your career? No, but you do want to brush up on your skills and make sure that you give yourself a competitive advantage. And the competitive advantage is that in this particular field, having as much knowledge and gaining experience allows you to, with the hopes to grab the attention of hiring managers. So I hope I answered that question. Okay. All right. Are postgraduate fellowships available for the field of healthcare administration and management? Absolutely. There's so many different types of postgraduate fellowships out there, especially for healthcare administration and management professionals, starting with the hospitals. So many hospitals have some type of what we call administrative fellows program, because those fellowship programs are preparing you to become a healthcare leader. And so that's just like, fellowships are really great. Many people don't tap into it. There's not much, I would say, information out there that shows you how to get a fellowship. However, if after this live, I'm going to put a link in the description box. I created a directory of exactly the name of the organization, their fellowship site, and you can just click on that fellowship site and it tells you if you qualify. I know the American College for Healthcare Executives, they post fellowships as well. And most of the fellowships that they post are paid fellowship programs. So oftentimes you need to either be graduated or graduating from a healthcare administration management degree. Usually you have to have a master's degree to do a fellowship, but I would encourage you, once this live has ended, to click on that link, sign up, and just get the fellowship direct access to the fellowship directory. I'll be updating it often, but that is a great way to also help you transition into getting a job in the healthcare administration space. Doing that fellowship, and in those fellowships, oftentimes they're project based. So meaning that you have to present, you have to connect with CEOs. I used to, for the hospital that I worked in, I used to have to onboard the fellows that they hired in for the administration role. And those fellowships can be 1 to 2 years long. So that's another way you can gain experience. If it's a paid fellowship, that's a plus, but also position yourself to be able to connect with the appropriate people post fellowship so you can get a job. Maria says, I'm thinking about joining the American College for Healthcare Executives. So yes, I did have a membership with them for a very long time, especially when I was working in the field, and I paid for the fellowship, and I really got a lot out of that being a member of the ACHE. They, once again, over there, they're posting job opportunities. There were different events that you can attend. I used to attend events like crazy and made myself be seen. So I used to ask questions, not necessarily because I was just asking the question just to ask, but the question was, one, to definitely to get me seen, two, to evoke conversation, and three, to show my expertise as the participant in the field, in the the room to connect and be in the mind of the presenters. I always used to gather the presenters' information. I would investigate them and kind of reach out to them where possible. Not everybody responded. So just keep that in your mind. Not everybody responded, but it was a good few who responded to me. We had conversation. They advised me. Actually, one of them became a mentor of mine for a very long time. So, fellowships and joining professional associations is also another way to position yourself in acquiring a healthcare job, particularly a healthcare administration, management, or even public health job. All right. So those are the questions that I had. I've answered those, but I am on. Does anyone else have any questions for those who are tuning in? Once again, if you're tuning in, welcome. This is our first Q&A session for the For Health Scholars community. I think it's going really well. So I may do this more often in the new year of just coming on to just give the community the opportunity to ask me questions and to hopes to get an answer for your questions. All right. So anybody else have any questions? All right. I don't see anything else in the queue. All right. So we've been going for almost an hour. But before I go, once again, post the end of this live, I'm going to post a link for access to this fellowship directory. It's completely free. You can just go and explore that. If you are interested in fellowships, there are so many fellowships out there. It does take a bit of preparation. And so in the new year, if you're on the For Health Scholars mailing list, so if you sign up for the directory or you sign up on our mailing list in the new year, I'm going to record a video specifically for the mailing list people on about fellowships and how to apply for fellowships and the things that you need for the fellowship, like the documents you need for the fellowship. So get connected with us on the For Health Scholars mailing list. I'll be sharing more information there in the new year. But to access this directory, you just click the link, just put your name and email address. And once you've done that, it will now redirect you to where the fellowship directory list is, and then start from there. But if you don't have any questions, I want to thank each and every one of you for joining in tonight's Q&A session. I hope it was helpful. I hope that you've gotten some answers. Like I said, I'll plan to do another one of these in the upcoming year. But if you don't have any additional questions, once again, thank you. Have a great, happy new year. And I look forward to connecting with each and every one of you in 2023. Bye for now.